Today, I have a special guest, Dr. Della Mae Chadwick, episode 19, because that's in the order I uploaded it. This was my first podcast. It wasn't as organized as I would have liked to have been. She responded because I just posted something about, is anybody interested in exploring the psyche and holistic health? And she responded because that's right up her alley. She's an acupuncturist, studying Chinese medicine. And there's so much there, and she admits that there's so much more for her to learn and discuss, but she has a wealth of knowledge that she's willing to share.
I have been a personal trainer for 27 years and a massage therapist for 20. I got my master's in Oriental medicine probably 12 years ago, and a few years ago, I got my doctorate in acupuncture and Chinese medicine. When I was younger, my dad was really sick and he kept getting sicker and sicker. And I knew that had he taken care of his health and exercise and eaten better, he wouldn't have been in the situation that he was in, or at least would have delayed it anyway. It did motivate me to go into like this nutrition focus and supplement focus and, working out a lot. And I worked with a trainer, and he was a professional football player, and he really inspired me to become a personal trainer. And within 6 months, I became a trainer, and I loved it. I knew that had my dad had a trainer, it would have made a really big difference. So when I was 21 years old, soon after becoming a trainer, I got into a car accident. I was going to get my degree in art, and that was a quick pivot. As soon as I got into that car accident, I started getting massage. I started taking care of my health in a different way. I'd never done acupuncture before. And when I was coming back from massage therapy appointment, I was driving through a particular town. I looked up on the building, and there was a 5-element theory acupuncture sign. And I was like, I was really struck. I was overcome. And I was like, that's it. I had never had acupuncture before. And I said, that's it. That's what I'm supposed to do. So within a week, I made an appointment. My aunt used to come and stay with us like one day per week, and she would go to work. She would always go see her acupuncturist. So she would always talk to me about acupuncture, and I was always intrigued. And I always had a lot of questions for her.
Do they have specific conditions? Are you what type of people come to you?
I find the people that I'm drawn to and that are drawn to me are people who have emotional, mental, psychiatric issues. And so that has always been my passion. I have found that in Chinese medicine, it's rooted in emotional imbalance. It's the emotions that can upset the system. And a lot of people think, oh, licensed acupuncturist, needles. And with Chinese medicine, like I tell people, it's like, oh, I'm afraid of needles. No way. I'm like, well, don't get needles when you go see your acupuncturist. And they're like baffled. I don't understand that.
Yeah,
Like, there's so much more to Chinese medicine.
sure.
By the end of my Oriental medicine degree, I was like, herbs, acupuncture, it's been proven to be profound in the results with veterans and other PTSD patients. So that's usually what I'm dealing with is PTSD.
I mean, I do know some healers that are actually like it drains them. So I guess there's both aspects of it. How tell me more about like how this has changed you and your lifestyle and your health.
I learned very early on techniques in order to pull energy in through me and out and not absorb their energy. And so Qigong is where it's at for me. And
felt like you would be unable to provide the right care, that you'd have to cancel somebody based on like just like I can't do it right now. And like
yes. So I don't want to give crappy treatment because I have this feeling or anxiety or frustration that this person is talking, or whatever my distraction was and my emotional reaction to the distraction. I don't want to give that. So like I can't touch someone's body when I'm feeling that. So whatever, but for me it's visceral. I can feel it in my chest and in my stomach. And when the feeling is strong and I'm connected to it, then I know I have to do something. Like that's it. I have to ask for what I need. And if I'm not going to get what I need, then I need to make changes. And that's just the way it is.
Yeah. Are you stronger in some area, whether it's psychologically or I mean, because you mentioned it, I mean, a lot of these things that how to prevent it draining you. Are there any areas that are just intrinsically beneficial where you're able to maybe by understanding the body that you're in more touch with your own body or something?
Really, my whole journey with Chinese medicine, and understanding, I mean, I definitely don't have a mastery of it all. I'm going to spend the rest of my life studying this. It's like, it's so vast. I had no idea what I was getting myself into. Through that journey, learning how the body systems are according to Chinese medicine, and having an understanding of the emotions that are tied to what things might be out of balance. And do you know what the solution is for addiction in Chinese medicine? He said, no. I said, it's creativity for what's called a liver imbalance. And he's struggling with addiction, alcoholism, and it affects the liver. So it's such a great solution. And I also added and compassion to touch upon what you're saying about the Thai having something similar. There's a reason why it's a master's in Oriental medicine. So having it come from China and come to Japan, and then Japan developing their own Japanese scalp acupuncture, and like doing hara diagnosis in the abdomen. They have their own style. The Koreans have hand acupuncture, and the French have auricular acupuncture. So it's like everyone, Western medicine has its place, and I do integrative care. And then they'll describe what's going on, and I'll say, you need to go to get an MRI, or you need to go to your primary, and you need to ask for this, this, this. There's a diagnosis in Chinese medicine, and you do treatment based on that diagnosis. But for me, they work synergistically. Chinese medicine should be approached as number one, nutrition. Yeah. Number two, Chinese herbs. And then, the acupuncture is like, I said it earlier, the icing on the cake. But do you know how much research that is out there? Like how many case studies that have proven the efficacy specifically of acupuncture? They focus on acupuncture. He had no idea.
Yeah.
And it's so important for acupuncturists to be able to have a direct line of communication with the Western medicine doctors. They need to be on board so that it's working. You work synergistically and together as a team. I believe in having a team, not just one approach. Yeah.
Looking at our own mortality. So like, I guess the question in short is like, is there a preferred death that you can name offhand?
This is my belief. I'm here for a probationary period to learn the lessons that I need to learn. And then I'll just go to the next life.
Sure.
So, and hopefully it's not like a terrible like, so to answer your question, I prefer that's a more peaceful transition.
Yeah, for sure. Yeah, there's so many people that they don't want to die in hospitals, yet so many people do die in hospitals, and it's mostly because of the way that they look at health, and they look at it as they need some authority. Obviously, I think Chinese medicine would be a better way to provide somebody with that peaceful death that they want, rather than submitting to letting the medical establishment kind of take care of us in the end, when it's almost assuring that you'd be in a hospital. But I guess so.
I believe that I'm here to facilitate deep, incredible healing and catalyze positive change. And I know I need to be the most powerful woman and healer that I could possibly be, which means I have to take care of myself first. I've already affected change in like thousands of people's lives. How many more thousands can I affect?
Yeah.
I mean, I might only live one more year, but I'm still going to focus on being connected with my higher purpose.